Hello. Parents occasionally ask me, how does a healthcare provider go through the process of determining the diagnosis for a child? Well, it's important to understand that in the first place, the process of diagnosis in modern times is based on behavioral criteria, not opinion. And it is a misnomer that you need brain scans or electroencephalograms to assess brain functioning. The most effective way to determine what is happening with a child is simply through observation. Now, when an expert is observing a child, what we're looking for are specific behavioral criteria that indicate what the child's emotional age is, what the child's cognitive age is, and what the child's social emotional skills are. And so when this is being applied in a clinical setting, clinical judgment comes from knowing what the behavioral criteria are for all of the many different conditions that a person can have. Whether we're talking about something as uncomplicated as speech delay or more complicated like intellectual disability. So all of these conditions require the expert, the healthcare provider, the person who's doing the assessment, and usually it's someone who specializes in developmental pediatrics, to look at what the child is able to do at his or her current age and relate that to what another child is able to do at that same age. So one, we're looking at behavior, not suspicion, but rather specific behavior. And there is a diagnostic and statistical manual that indicates all of the behavioral criteria that determines if a child has intellectual disability or autism or attention deficit hyperactivity or depression or anxiety or obsessive compulsive disorder. All of these are determined by behavioral criteria. And the expert looks at the individual and determines, based on the number of criteria that are being met during the typical 50-minute session that the adult has with that individual. Thank you for listening.
لما بدي آكل برتقال بقول بدي آكل برتقال.
ماي بس انه يعني كمان انا بستنى فتره على الطفل لحتى يتذكر شو لازم. ماي انا لما بدي اشرب ماي بقول بدي اشرب ماي. انا بدي اشرب ماي. انا لما اشتي ساره تزني اقول ساره لو سمحتي هزيني. ساره صرت تزني. سارة لو سمحتي هزيني.
بلاش بدي اسنيك.